probably causes stress and frustration.
Stress and frustration is just not, yeah, exactly, not healthy. So, so eating, she did a 20-hour fast, 4-hour eating window, and she ate according to the style that Mindy Pelz recommends, which is keto biotic, meaning keto and probiotic foods to really help build the gut. And so, yeah, that way of eating, I think, is a fantastic way to optimize your health, right? So from a dietary standpoint, intermittent fasting, keto biotic, that's my strongest recommendation at the moment. Things always change. From an exercise standpoint, so this lady, this 101-year-old, when I was interviewing her, she's like, I've been walking forever since I can remember, right? Like just daily walks. Yeah, go for walks. A little less right now because she's dealing with some pain, but that's what she has done to maintain a healthy life for all these years, and then dancing once a week, sometimes twice a week, line dancing.
My mom did that for a long time.
Did she really?
Would go weekly or sometimes twice a week.
Line dancing? Yeah.
Various kinds of dancing.
Oh,
she just loved it. So besides the physical exercise, just the joy that it brought her, I think, carried her for longer than she would have gone otherwise, I'm sure.
I love dancing. I highly recommend it to people from the standpoint of, when you're at the gym, it's a two-dimensional movement. When you're dancing, you're going in places that your body is just not normally used to going. But then, from a physiological standpoint, you're getting synovial fluid through the joints. You're getting things to move that should be moving that hadn't moved in years, right? So dancing's fantastic, and you can have fun with it. So yeah, if you get into dancing, that's probably such a great idea. So exercise for her, so a daily walk, and Kaiser did this big study. It was 150,000 people, and Kaiser patients, and they found that if you hit 7,500 steps around there a day, your chances of getting strokes or cancers or heart attacks were greatly diminished. Your chances of going to the doctor for any sort of reason greatly diminished. So the average person walks about 2,500 to 4,000 steps a day, just going, daily life. So if you were to try to hit 7,500, that sort of means about a 30-minute walk. So if you can do a 30-minute walk a day,
that sounds doable.
Yeah, it's a fair price to pay for avoiding the pitfalls that are taking us out. The diabetes, the strokes, the cancers. So during the pandemic, and then after that, I started just doing a lot more walking, and I'm like, this feels fantastic to be able to walk. At one point, I was trying to hit 20,000 steps a day, just as a kind of fun thing to try to accomplish, and I was like, I'm feeling great doing this daily walk. And so I'm always hitting the patients with, go for the daily walk, try to hit the 7,500 steps, 10,000, even better, Which, but a side note, 10,000 steps, there is no magic reason for that. Apparently the guy who created the pedometer, the Japanese gentleman, it's an auspicious good luck number in Japanese. So 10,000 steps.
Good round number, it's a good
round number.
Anyway, yeah.
Exactly. So doing the daily walk, as I think is an important thing for all of us to do. And then anything you can add outside of that is bonus. So if you want to strength train, that's probably a great idea too, but it's not necessary. The 101-year-old and the other older folks that I was interviewing, like we have a 98-year-old, there's this 95-year-old, all very similar. They didn't do any lifting weights. You go to the blue zone regions, they don't have big old gyms and they're not pounding weights. Right. They're just going about their life, and what you'll notice is there's just a constant motion going on, constant perpetual, that's what we are. We're constant perpetual movement machines. And the big problem that we have in our society is that we sit too much, right? And so,
guilty.
Yeah. I was listening to Dr. Kelly Starrett, renowned physical therapist. He wrote a book called The Supple Leopard, and he said if the sitting went away, the $1 billion back pain problem in the United States would go away. And I agree. We're just really not meant to sit, yeah. And it causes so many issues. We can maybe delve into what you can do around that in the future, but so.
Where does bicycle riding fall into that? Could that substitute the 30-minute walk?
Absolutely. Motion. Do what you love. If it's bike riding, then it's bike riding. If it's dancing, it's dancing.
I've found you can ride around basically the perimeter of Mountain House and get 10 miles in.
Yeah.
That's
perfect.
Not bad.
I love it. Yeah, yeah. And you're still pumping joints. You know, if that's what you love to do, then do it. It's another form of exercise that's fantastic. Swimming, that's really great. The way that you can move your shoulders, that
easier on your joints too.
Easier on your joints, exactly.
Playing tennis.
Playing tennis, pickleball. I just found out pickleball is fantastic. I just discovered it, and I was like, I see what the hype's about. It's fun. And we still haven't got you to play pickleball yet.
No, but the city council just approved to add pickleball integrated into the tennis courts. So initially we have the 3 tennis courts. They're going to make where court number 1 is, and they're going to line it so that they can switch it to pickleball certain hours of the day.
Yeah.
And then, you know, they're about to build 9 more tennis courts, and they're going to integrate some of that in with pickleball as well. So
that's fantastic.
Specifically because they've had residents request it, that they really want to play pickleball. So
yeah, I'm glad to hear that.
I've never played it, but I'm game.
Yeah.
I'll do it.
Well, you play tennis. We played tennis before. You're good at tennis. You'll pick up pickleball.
Yeah, he's better at tennis.
But
it's always fun.
It's always fun. It's really about just going out there and just swinging away, having fun, running around.
Yeah.
And this guy likes to run around, by the way. Like if there's no sweat going on, I don't know if he'd be as interested.
It's one of the reasons it's fun playing with you, because you make me run.
So we got the exercise. So diet, exercise, sleep is a huge thing. You know, in our society, sometimes we venerate or whatever. Like we vilify not sleeping. And it's like it's a badge of honor to like push hard. But the studies show over and over again that sleep is huge. I bumped up so many people with sleep issues, right? And here's what I could say to sleep. It really boils down to 2 hormones. It's melatonin and cortisol. And our society wrecks that, right? Because we have the phones, we have all the TVs and the lights, right? All of this stuff, go back 150 years, 100 years, we didn't have this, right? This is all like a modern invention.
Barely had lights.
We barely had lights, right? For the majority of the human timeline, we pretty much went to bed when the sun went down, and we woke up when the sun came up. And now, who does that, right? like who goes to bed when the sun goes down anymore, unless you live on a farm somewhere, right? So we are fighting a lot of our evolution and our DNA. And that's a big problem, because you start to see, like, you know, when you stack sleepless nights, it's almost like you're like drunk out there, right? Like you're impaired.
It's not good.
Yeah, and I don't recall the studies, but like basically hand-eye coordination deteriorates. You know, your mental acuity goes down. So many issues related to sleep problems. Now, Dr. Andrew Huberman out of Huberman Labs in Stanford, he suggests. Now, this guy has poured through mountains and mountains of research, and he says the healthiest practice you can get into of them all is just to get morning sunlight. Because morning sunlight, it sets your circadian rhythm up, and then it tells you, it immediately picks up your cortisol, then naturally kicks up then your melatonin about 12 hours later, so then it becomes much easier to fall asleep. Now, if you can...
Interesting.
If you can mix that in with cutting out all your electronics about an hour before bed, like we tell our kids, then you're now creating.
Is that what you tell the kids now? An hour before?
Yeah. Maybe even
They're
more
hiding
than that.
under the covers with it.
Well, I just caught my son a couple times with the, under the cover. I was like, "What are you doing, man?" But so if you can mix those 2 together, morning sunlight, first thing in the morning with movement, you know. And I'll tell you a hack I have in a second, and then get all the lights turned off, or to really diminish or cut your electronics and your lights, dim the lights about an hour before bed. And you do this on a schedule, then you can really create the sleep patterns that will get you into easier sleep. And sleep is so important. I mean, more important than we realize. And my personal hack in the morning, sometimes I'm like, gosh, it's too cold out there. I bought a lamp, a sun lamp, like in places where they have seasonal affect disorder, you can get a lamp that mimics the rays
Alaska,
of the sun.
I guess.
Yeah, and then I got a walking pad, and so sometimes you'll catch me in the morning, I'm like half dead, put my lamp on, do my 10-minute walk, and then 10 minutes later, I'm wide awake, bright-eyed, bushy-tailed, like a shot of espresso. And so,
Wow.
yeah, morning sunlight. First thing in the morning, a super powerful practice, helps with sleep. So we got the diet, the exercise, the sleep, stress. That's a big one. That's probably a 2-hour-long talk as is, right? But
No doubt, yeah.
how much time do we got, by the way?
I think another 5 minutes or so.
Okay, let me speed through this.
At most, yeah.
So stress is the silent killer, right? It's behind the scenes of every disease state you can think of, and who doesn't have stress in our society, right?
It's the way everything's built.
It's just the way
is.
everything rolls these days. I was listening to it was Bruce Lipton. He wrote a book called The Biology of Belief, right? And the big premise there is that thoughts are things, right? So he was talking about placebo effect, for example. There's this interesting study. They had these orthopedic surgeons who were curious about what particular part of their knee surgery actually helped the knee, and so they created an experiment. But part of the experiment was to have a control group where they gave these guys a fake surgery. Just put a couple incisions in their knee. They put someone else's video of a knee surgery going on, and so these guys bought in to the idea that they got a knee surgery, and so they were shocked to see that the people who got the fake knee surgery did just as good as the people who got the real surgery in terms of range of motion, in terms of pain, yeah.
With similar injuries and such.
Exactly, yeah. And so, but it's widely understood that the placebo effect accounts for about 30% of outcome, right? Meaning like you give a group of 100 people a sugar pill, tell them that this is going to lower down your blood pressure or whatever, you can expect about 30 of those people to have the effect of it. And so basically the
power
brain
of the mind, really.
is powerful. And so Dr. Bruce Lipton was saying too, another example, by the way, is like schizophrenics, how this is shown in labs, and there's movies made on this. Like one personality of a schizophrenic may have hypertension, diabetes, lots of pain. They'll switch over to their second personality, that goes away, and now it's asthma and allergies, and the pain had come down. And then the third personality has no pain, no health issues. And like what's going on there? Basically, each personality has different responses to the environment. Basically, the idea is that we're walking in life and we're making these constant decisions about is the world fearful? Is there something to be stressed about? Is there something that I should be worried about or concerned with, right? And then all that elicits a response in your physiology. So the difference in those personalities is that they're taking on the world and then creating a chemistry that then manifests into one physiological
state. So the illnesses
state.
are real within their being because that's the life they're living. And
yes, yeah.
It's not that anybody's faking it or that it's not real.
That thoughts manifest reality. Reality can be disease or not, right?
Yeah.
And so, when you take in stress, if you look at it for that lens, it's like, okay, how do we manage stress in a way that doesn't present a physical manifestation of something we don't want, right? And so, life then becomes a way of managing your life so you don't increase the stress levels and having negative responses in your body. There's a number of physical, I look at stress like a teeter-totter, right? We should have this equal balance. We don't want to have, it's a sympathetic, which is a fight, flight, stress response, and there's the parasympathetic, the rest, digest. We want this nice balance because if we're the parasympathetic is really kicked up, that's not really good for our systems either, right? That slows the heart rate. You'll have low blood pressure, right? You won't be motivated to do anything. There's a healthy amount of stress that's needed for us to get things done, right? Balance. So, but unfortunately in our life, we're like America runs like this. We run hot. We run high stress. That's the way we like to do it, right? Cup of coffee, blast the system, sympathetic tone, give me all of my deadlines, and that's how a lot of us operate.
Yep.
But at a cost, and the cost is health troubles. So one powerful way that I like is
heart health, even.
Heart health, yeah, absolutely. You would consider a stressful life leading to that for you? Yeah.
And other factors.
And other factors. So I like deep breathing. I like gratitude journals, personally speaking. There's a practice called the physiological sigh. Again, Dr. Andrew Huberman. When people cry, they do a double breath, and that's a really fantastic way to just kick up your parasympathetic tone. So from a stress standpoint, whenever I'm feeling stressed, I'll do a 4-second inhale followed by a physiological sigh. It looks like this. I'll hold my breath for 7 seconds and then exhale out for 8 seconds. And it's just a combination of different breathing techniques.
So you don't have to make yourself cry.
No, yeah, don't make it. I mean, if it helps you, why not? A good cry. It's been a while.
It's a healthy thing.
It's a good thing, yeah.
But as a general practice, you can do the breathing exercise and just emulate that.
Absolutely, yes.
Pattern.
And then I'm a big fan of gratitude journaling. The idea that the mind, what you focus on, you bring more about. And so I think I'm on day 312 of writing 30 things that I'm grateful for every day.
Wow.
And it's been a game changer for me in many ways. When something bad happens, I'll look for what can I be grateful about this? What good can I pull from this? Now, with the idea that my thoughts create physiology. And if I'm sitting there thinking, why me again? This problem again? Why this always happening?
It's easy to be frustrated about a lot of stuff that happens.
You can be very easily frustrated by a million things in life. And if we're adopting the idea that your brain can create body chemistry, probably not a good idea to really allow yourself to get too far into the weeds with that. You want to be able to control your mind and bring it to a more positive state. And that's what I do. I'll use the gratitude journal to just bring myself back to this place.
So maybe we should make a Mountain House challenge of doing a gratitude journal.
I'm all for it.
Every day, that's a lot. 30 things?
If you guys could just walk every day, do 30 things you're grateful for, I'd say it'd change your life. It'd change your life in profound ways. I'll throw that out there. So stress is massive, and then I wouldn't be a good chiropractor if I didn't say the nervous system is a powerful force on the system. I always tell people what we do is we look at the brain to body communication, and we have millions of bits of information passing back and forth between body and mind per second, and if there are interferences in that master control system will affect your cardiovascular system, your digestive system, your endocrine system. So really, all that we can do to clear up the communication channels between the brain and body leads to a better nervous system, leads to then better health. And you can extrapolate that from everything from my headaches go away, to my back pain goes away, to my seizures go away, to everything in between, right? So diet, exercise, sleep, stress, and the nervous system. That's the key to living your best health for 2025. I'd love to see you guys adopt one or more of those practices. If you see me on the street, let me know. And
tell them what you're grateful for.
And tell me what you're grateful for. Thank you, I appreciate that.
Well, I really appreciate you being here with us tonight, and
my pleasure. It was a lot of fun. Thank you.
We hope to have this be a regular thing with Dr. Chituri and whatever else we can do, and just help develop healthy patterns for people in Mountain House. And I think you've contributed a lot to that tonight. So
I appreciate you.
Here.
Thank you, Brian.
Appreciate you.
Thank you.
All right.
Appreciate it.
Dr. Joe Garrido with Valley Chiropractic, Mountain House resident, and man about town.
Yeah, appreciate it. We're doing a little
Thanks for
switcheroo
being
here.
Yeah, I think so.
Yeah.
So I want to welcome Dr. Chituri, who just walked in the room, to be with us. If you missed it last month, we did our initial episode of Mountain House Health Matters, and we didn't have the luxury of working with Khalid here at Zaytech. We just winged it on our own. We were actually in Dr. Chaturi's bedroom on one computer, just sharing the computer. You can go watch that. It's on YouTube. There's a link to it on the Facebook page. And all of that said, all of our technical difficulties, and that day, my whole day was like that. It was one of those days where everything was just like that. The content that he shared in that evening about respiratory illnesses was really fantastic. So if you haven't seen it, I would invite you to do that. Please come join me here.
Hi.
Satya, pleasure to
Nice
see
to
you.
meet
Glad
you.
you can make it, man.
Got you guys on Facebook.
All right, thanks, Joe. Thanks for being here. How's your day?
Good, good. How are you? Are you live?
Good. I traveled a little bit. You went to Stockton today?
Yes. I was talking today.
I went to
Was
Sacramento
it
today.
Sacramento?
Yeah.
Wow.
So in our first episode, we got to get the mic. Can we do that?
That's right there. There you go.
It goes on my shirt.
Yeah, on the top. There you go. Perfect.
Live streaming. I was really hesitant to do a live stream thing when we first talked about doing all this. Khalid had been trying some things and setting it up, and it was a great suggestion. It's a little bit nerve-wracking though, because things happen. You're just dealing with reality in life. So there's no cut, there's no second takes. You get what you get. Let's give a sound check for you.
Can you hear me? On the mic check.
You don't want to have to hold it though. I'm holding this because this one wasn't working well enough.
Okay. Yeah, I think we can hear well.
Yeah, you probably won't hear it because we don't want the feedback from that. But
Right.
so welcome. This
Thank you.
is our second episode of Health Matters, Mountain House Health Matters. Last month, as I said, we talked about respiratory illnesses, and tonight, because it is Heart Health Awareness Month, is that
So
correct?
this February happened to be National Cancer Awareness Month.
Oh, Cancer Awareness Month. Oh,
Yeah.
That's right,
And
that was on
so
there,
we
huh?
had two topics to discuss today. One is
obesity.
which is indirectly related to cancer too. So I thought these two will be good topics to discuss today.
So is our sound good, Khalid?
Sounds good.
And if you guys want to like and share and subscribe and all of that stuff, if you have questions, you can ask your questions. I think we'll hopefully have a few minutes to get to that. We tried to do that last time.
Right.
And
Last time the comment section did not work. Is it working this time or?
Yeah. It was because I had clicked that it was good for kids or something on YouTube.
Kids can't comment.
Yeah. There's something about that. I clicked the wrong button in YouTube, and then we couldn't get comments. So
Right.
we would welcome your comments and questions. And yeah, so let's move forward. So you're a partner at the Assure Primary and Urgent Care over here in the Mountain House Shopping Center. And that's where people can find you.
Right.
In your office there.
Yeah.
Or not always you. You have partners that are there as
Right,
well.
right. It's been 1 year now for Assure. We
As
had
of
our first anniversary
February-
February 11th,
Oh,
first anniversary.
wow.
Yeah, it's
Well,
been 1
happy
year
anniversary.
already. Thank you.
That's
Thank you.
crazy.
It's been first year and we had...
Dude,
we
you
had
survived a year. If a
survived a
business
year
can
and-
survive a year, that's
We are happy to serve the community and we are happy to bring more. Yeah.
congratulations.
Thank you. Thank you.
So it's a celebration tonight. It's the first year anniversary of Assure. So last time you pretty much had your thing pretty well together, and I just sat back and let you
Right,
go. So
right.
you're welcome to do that if you want to do that again.
Sure,
or we can
sure.
interact however you want to do
So
that.
do you have any questions before we begin with? Or do you want me to-
Well, tell us a little bit about your first year. How has that gone?
First year has been good. I mean, initial months were kind of slow because people had to get to know us initially,
And you
like
were-
any other new business.
And you had to get insurance. stuff set
Insurances,
up and all
that took a lot of time, getting credentialed with most of the insurances. But from July and August, after we started having many insurances credentialed, and people who came to us few times started trusting us, that you build that patient-physician relationship.
Yeah, that can
And
take a while.
now I think people are coming more trusting ours more compared to Tracy Urgent Cares in terms of, our care, and also the wait times and everything are less for us. And this flu season, we are glad to serve our community. We also have lab testing right now in Assure, starting from January 1st week. So we had so many flus and COVIDs, and without any delay in treatment, we are able to serve our patients here.
Yeah, since we spoke even last month, there's been a lot of talk in general media that the flu, I've heard it called an epidemic. I don't
Right, it's quademic right now.
Oh, that's
Flu,
right, that's what you called it
COVID,
last time.
yeah, flu,
I was
COVID,
gonna look that
RSV, and norovirus. There are 4 viruses rampant right now across US.
Has that pretty much stayed the same or gotten worse or gotten
Flu
better?
and COVID has gotten better. Influenza is still the same. RSV is also still high.
Is it?
Yeah. And,
The city council meeting was last night, and the city manager had his report, and part of what he does is show a graph of the water testing that they do, I think the
Right,
wastewater
right.
testing, and COVID they showed is down, but they didn't really talk too much about the flu.
Oh, it's interesting. I didn't know that our city does the testing too, because in the talk that I gave last month, we had a comment on that, because California Department of Public Health, they do water testing, and there were high levels of COVID and influenza virus last month at that time.
Yeah.
I haven't seen
I think that was
airport
true
recently.
here
That's
too.
true
At
here
least
too,
it
yeah.
was a bit of a spike from where it had been.
Wow. So he told that COVID was high or
No, that it's going back down.
coming back down? Okay.
Yeah.
Okay.
I
Very good.
was going to gather up that chart so we could put it up, but maybe we'll
Once
add it later.
we have warmer months, these numbers of COVID and influenza will cut down. Definitely, it's basically the cold weather also.
Contributes.
Viruses prosper in cold weather, you know.
Yeah.
Okay. Yeah, and everybody stays indoor, you know, sharing the infection and all. Yeah.
Or they're not aware that they have it, and they go outdoors, and they're in meetings with people. And
Right.
It's a fascinating. I think we'll be studying the effects of the pandemic for years, because if people remember it, because so much of that is just like it never happened,
Right.
and yet, is from a memory standpoint, you know what I mean?
Like 2020?
Yeah.
Yeah.
Like the time we were just talking with Dr. Joe, that I've known him, I don't know, probably 10 years, but it seems like there's a gap in the time we had because of COVID. And I think
Right.
that's true with most everybody.
That's true. Those 2-3 years were rough.
It's crazy.
Yeah.
So tonight we're going to talk about obesity.
Right, I have my cheat sheet and some notes that I've written. So obesity. So many people are conscious that they're obese, but they don't know the gravity of the seriousness and what kind of medical problems then can obesity cause on the patients. So obesity is mainly measured by BMI. If anybody asks, how do I know whether I'm obese or not? Check your BMI, body mass index.
Body mass index.
And depending on that, you'll know whether you're obese or not. If it's more than 25 to 29 is overweight, and 29 above, and 30 or above is obese. So you calculate your body mass index based on your weight by height in meter square. Weight in kilograms, kilograms by meter square. So everybody can do this at home. Doesn't need to go to any doctor to do this. You can measure your height and weight at home and calculate yourself, and you will know right now, on the spot, whether you are obese or not. And then if you are an
You
overweight,
probably already know.
there are like at least 40% of adult population in US has obesity.
Yeah.
And in children who are more than 2 years old, 2 to 19 years old, 20% of the population is obese. People think
20%?
20% of children are obese. And people think if they are kids, they can eat anything. They can.
'Cause they're out running around
They
and
can run
doing-
around, but that's not true. Like my wife is a pediatrician, Dr. Shita. She sees so many patients who are diabetics in the ages of 10 years or 8 years. People are getting diabetic, and they had to be at a level of diabetes where they had to be started on medications. So it's
Is
all
that
in
a
the food.
type 2?
Type 2, not type 1. Type 1,
Type 1 you're
we
born with
can't,
it, right?
with kids, and that's expected. Type 1 happens in kids, but type 2 diabetes in kids because of this obesity.
And type 1 doesn't even necessarily have to do with your...
Weight, nothing.
Yeah, your weight or anything
Yeah,
like that.
it's mostly because your body is not secreting enough insulin to process the glucose. But type 2 is your body has too much glucose and insulin is not working enough.
So what do we do about it?
So obesity, first thing you do about it is keep an eye on your weight and what you are eating. So screening for obesity is very important. So every insurance covers for your annual physical. And when you go for annual physical, make sure that your height and weight is measured by the physician and check your BMI. Or you can do it if you have a scale at home, check it at home. And check where you are and make sure that you trend it. And even if your BMI is not in the obesity range, but if your waist is greater than 40 inches for men and 35 inches for women, you are still in the obesity range, and you are at high risk for having comorbidities like cardiovascular, whatever obesity can cause. And people with obesity should keep an eye on your on your blood sugars, on your cholesterol, and obesity can be from your thyroid problem too. So obesity can be because of multiple reasons, not only just overeating. It can be overeating. You might be eating less, but you might be binge eating at night. That can cause obesity too. Abnormal eating habits, overeating, lack of exercise, stress. Stress itself causes obesity because you don't sleep well. I think the previous doctor was talking about sleep and stress, right? So sleep and stress can lead to this, and thyroid problems can cause it. So there are so many things that can lead to obesity. So make sure that you have your labs checked on time, and if there is anything abnormal, do not delay and act fast on them. And of course, physicians suggest about diet, and I would like to address the myth on diet. Many people think the fad diet, the popular keto diet, paleo diet, and there is some other diet. Let me see. I was reading about cabbage soup diet. This is the first time I heard about it. Have you heard about cabbage soup diet?
I've heard about that.
Yeah, I haven't heard about cabbage soup diet and detox diet.
Sounds awful.
Yeah. Who would drink cabbage soup 3 times a week?
Well, you have to be committed.
And there's a myth that these diets will help with weight loss. They will help with the weight loss, but as soon as you stop these kinds of diet, your weight will bounce back again. So these kinds of diets are not sustainable. So you need to have a calorie deficit diet, which can be usually you will need 22 calories per kilogram per day. On an average, if a 100 kilo person is there, you need only 2200 kilocalories. And there are so many apps available to count your calories. On top of I can think of MyFitnessPal, and there are so many other apps where you can calculate the number of calories. And if you cut down your calories by 500 kilocalories per day, you can see an average weight loss of 1 pound per week. So there itself, you are helping weight loss. If you don't have time for your exercise, you can still cut down your weight based on your diet. And of course, exercising is recommended, and many medical organizations recommend about exercising. You need not go to gym and lift weights. At least walking continuously for 30 minutes so that your maximal heart rate, which means while walking your heart rate goes up. You need to make sure that it stays high so that your brisk walk. It can be a normal walk too, but you need to walk for a certain amount of time. Walking for 2 minutes and resting for 10 minutes doesn't help. So you need to walk for 30 minutes. It can be a flat ground. 3 to 5 times a week will help with weight loss. So that's also good for people with hypertension and diabetes.
So if you walk to Starbucks and have a coffee and sit there for an hour, that
doesn't help. And first of all, coffee in Starbucks, if you add too much sugar to it, that itself will not help you walk. Yeah. Maybe you need to get without sugar.
That's what I get.
Right.
It's really easy to get a lot of sugar with a lot of their drinks.
Correct.
For sure.
Correct. Yeah. And so that's something I wanted to stress about, because I know my friends and stuff, many of them are on keto diet and they feel like that helps, but that helps only on temporary basis. And the detox diet also does not help. And there are many medications that are available right now in the market. Even if you go on social media, there are so many medicines. People are GLP-1 products for weight loss clinics. And these are right now FDA approved, but these are for people who have tried all the diet and exercises and healthy life habits. And if these are not helping for you, there are other ways to lose weight. So far, until recently, we had oral medications like phentermine, naltrexone and all, which had so many side effects, like nausea, sleeplessness, depression and all those things. But now there's new class of medications called GLP-1 products like Ozempic and Zepbound. Those are the popular brand names, which were initially introduced as anti-diabetic medications. And they work well. I have many patients who are diabetics and on these medicines, and these medications are mostly once a week injections. And
Oh, that's the shot that people are doing.
yes, there's a short.
And people have lost a lot of weight with that.
Lot of weight with that. Again, any kind of
I don't know
medication
that I want a shot.
is
every
not
week.
sustainable again. Even if you're using that, you need to make sure that you follow the other stuff. So those are ideal for people who have comorbidities like hypertension or diabetes. If you have, this medicine will help with your diabetes and will also help with your weight loss. So there are other medications like this that help, like because the GLP-1 products, like Ozempic and Zepbound, will increase the insulin in your body, and that help with the glucose metabolism.
That was the point of being anti-diabetic.
Anti-diabetic medications, and also they send a signal to your brain that you are full. So based on that, you don't feel like eating. If you are somebody who eats and snacks a lot, so these medications are very helpful.
Do they have an adverse effect to the wellness of your gut?
Yes, they do. Mostly Ozempic compared to Zepbound has effects of nausea, vomiting. Some people have diarrhea and fatigue. And most of the times it happens only in the adjustment phase, but most of the patients tolerate it. But things to watch out for is there are so many weight loss clinics available online. I would suggest not to use them because they are not monitored by a physician, and these compounded medications are sent from we don't know where. And these pharmacies should be registered with the Board of Pharmacy, and they should have a certification. But these compounded medications from unknown pharmacies can put your life at risk. But there, if you qualify, if you fit the criteria for diabetes or other stuff, even now the FDA approved medications for people who are overweight with high cholesterol or diabetes, or who are obese without any other medical problems, your insurance can cover for that. And those insurances, instead of compounded medications, give you the actual branded medication, which has less side effects and safer. And these medications are made in a more like controlled environment rather than a pharmacy from unknown place. Because many products, many ingredients of these compounded pharmacies come from overseas.
Do they have statistics or studies on people that use like that shot or the Ozempic? When they achieve their weight loss goals, are they able to just stop?
They will be able to stop, but
they
again,
bounce back with the weight problem? I guess it's a matter of changing your habits.
Exactly. Most importantly, more than any of the medications, you need to be disciplined. Your eating habits and lifestyle habits need to be consistent. Once you stop these medications, and if you start eating like olden times, you'll gain that weight back. Absolutely, you'll gain that weight back.
And then some, probably, in a lot of cases.
Right. And of course, these medications are expensive, not covered by insurance. So most importantly, you need to make sure that you exercise, eat healthy, sleep well, and if still it's not working, make sure that you get checked by the physician, and make sure that you don't have any medical reasons to be obese. There might be lifestyle reasons to be obese, but there can also be medical reasons. If you are able to control the main medical reasons like thyroid problems and other hormonal issues and stuff, then your obesity will be controlled.
That's good.
So that's what I want to talk about, obesity. And if any of the audience have any questions, please feel free to comment.
Please chime in on if you're on Facebook or YouTube, you can ask questions there. We've got Khalid over there kind of monitoring for us, so appreciate that, so we don't really have to worry about it too much. I got my computer here, it's not even on. I could probably look too. But you'll tell us, right?
So other important topic that we have for today is the Cancer Awareness Month, February. That's more, obesity is also important, but I feel like cancer is very much equally important. And many people do not know that obesity itself is the cause for 20% of the cancers. Obesity can lead to cancers, really, because being obese causes chronic systemic inflammation, which this inflammation itself, like inflammation means irritation in your body. Your inflammatory markers are high in your body because you're obese, and that predisposes you to have cancers. So research has shown that, and there are studies published on it, that obesity itself can cause 20% of the cancers. So not
That's
only for your
reason
heart.
enough to start taking care of that. Huh?
Exactly. Not only for your heart, not only for your stroke or anything else, not only for good-looking purposes, for preventing cancer too, you need to be aware that obesity can cause cancer. And so the National Cancer, February is the National Cancer Awareness Month, as we discussed. And there are, in 2024, the stats are so high that there are 2 million Americans diagnosed with cancer in 2024. Just in 2024, all the new cancers, not the old cancers. And the number of deaths from cancer in 2024 was 600,000, more than 500,000. The numbers are very high.
Now, it seems like generally with the treatments they have for cancer that they're able to at least fend it off, if not
Right,
put
prolonged.
it into
Right.
remission permanently than they used to. People don't die as readily from cancer as they used to.
True. There are so many advances in the treatment that we have right now. Early diagnosis is the key.
But you still don't want to deal with it.
Yeah,
I can tell
exactly.
you from
Isn't
my
it?
family experience.
Oh, sorry to hear
it's
that.
not
yeah.
fun.
Yeah. Early diagnosis is the key. Even people always hear about stage 3 cancer, stage 4 cancer. Stage 4 means spread all over. So those kind of patients, unfortunately, there's nothing much to offer for treatment-wise, but early diagnosis is the key. But today's talk, I would like to stress more on what can be done to prevent cancers.
I like that idea.
Research has shown that 40% of the cancers are from preventable causes. The preventable causes can be smoking, alcohol, that's the top two. Like you can stay away from smoking, you can stay away from alcohol abuse. Like drinking once in a while is okay, but if you're somebody who drinks alcohol on a regular basis, you put your body there itself for having a cancer. And obesity, as I discussed, is mostly like because if you're obese, your body is at risk for chronic systemic inflammation, which puts you at risk for cancer. So these three, and also physical inactivity, which is indirectly related to obesity, and sedentary lifestyle also increase your inflammation in your body. Even if you're not obese, if you're somebody who's sedentary, means like very much sitting in the chair, desk job and stuff itself can put you at risk for cancer. And
It's my job.
and sun itself, like, that's why you need to have to prevent damage of your skin from sun, and of course you need to apply the good sunscreen, and so that you can have protection. It's like a barrier, protection from the first skin cancer. And so one common cancer, one of the viruses, HPV virus, causes so many patients with cancer, mostly like cervical cancer, anal cancer, penile cancer, for the cancer of the penis and all, and it's very common. It's very easily preventable. As per UPSTF, Task Force for Preventive Medicine in US, recommends HPV vaccine, which is a 3-dose vaccine for patients less than 25 years, starting from 15 years. So 15 to 25 years, you get 3-dose vaccine. It is covered by all insurances, and your primary care doctor will be able to offer you the vaccines when you go for annual physical. And there are studies published that this vaccine will protect you from getting cancer, because HPV virus infection puts you at risk for these cancers. So rarely we think viruses cause only infection, like
So
cold.
is it that it reduces your immune system's ability to fight off cancer? Is that how that HPV works? Is that
HPV is called human papilloma virus. It alters the morphology of the cells and causes cancer, the virus.
oh
So this vaccine helps you fight that virus. So it's Gardasil is a very common brand that's used. So
it actually alters cells as well?
yes, alters cells in that area, and it's a sexually transmitted disease, HPV. So So you need to, and adults who are at risk for sexual transmitted diseases, even if you're more than 25 years old, you can still get the virus. Sorry, you can still get the vaccine. But you're 15 to 25, everybody it's
That's
recommended
what
for
they're
everybody.
doing now.
Yeah, so that the future generations are protected from that cancer.
So, at least in theory, the cancer rate should drop over time.
Right, that particular cancer.
Yeah.
Right,
those-
cancers that are caused by HPV. And many occupational hazards, like people exposed to chemicals, put themselves at risk for cancers. They inhale all the fumes, the skin that they work with, chemicals falling on the skin, they put them at risk for cancer. And it has been shown that people who are working in an environment which are exposed to chemicals, but working night graveyard shifts are at more risk for cancer rather than people working in day shifts. Because at night they don't really pay much attention, they get negligent, and they don't take the protective measures. So the reason I'm saying this is even you're working day or night, and if you're somebody who works in that kind of environment where you're exposed to chemicals, please make sure that you take all the necessary precautions. Because these effects don't happen in a day or two, but if you continuous exposure for months and years together, will definitely damage you.
Adds up, yeah.
Yeah. So we have many guidelines that also helps the physicians to help treat their patients. I would like to talk about some common cancers, which are common preventable cancers. First, most common thing is the breast cancer. Many people are not aware that when you turn 40, you are eligible to get a mammogram. And it is recommended to get a mammogram every 1 to 2 years up to the age of 75. I've seen many patients and they get a mammogram in 40, or sometimes they come to the physician and ask for a mammogram after they observe a lump in their breast. And they're like 45, 46, which...
Probably should do it before that.
Yes. And breast cancer itself is very life-threatening. And also stress and everything that they go through. So mammogram is a very simple test. You get
From what I understand, it's not a lot of fun.
It's not a lot of fun, but cancer is no fun either.
Well, that's true. That's a good point.
Yeah. So once in every 1 to 2 years, it's better to get a mammogram. Same with the pap smear. Once in every 3 years, women can get the pap smear so that they can check for cervical cancer. Because the cancer, the cells do not change to cancer cells directly. They go through a journey. The normal cells are altered to abnormal cells, and abnormal cells can become cancer cells. So when you do this pap test and everything, you can catch the cancer in the abnormal stage itself and take care of it before it becomes cancer. So there also the pap smear is important, and same as mammogram. Actually, people get mammogram more than pap smear. Pap smear, they tend to neglect. And pap smears can be done by your OBGYN, it can be done by your primary care doctor too. So you not wait for an OBGYN appointment to get a pap smear. Majority of several primary care physicians in the community are trained to get pap smears. And it's done right in the office. So that's one more cancer that can be prevented. And colorectal cancer, colon cancer, there are two ways of screening for the colon cancer. One is to do a stool test. The other day I had a patient who had a stool test. You get a card, you might have seen people getting
The Cologuard method.
yeah, where you put a swab of your stool and ship it to the lab and they test it and you get a result. I had a patient who said that, oh, I had a card test 7 years ago. Does that work? No, it does not. If you're doing a card test, you have to do it every year.
Oh.
Many people don't know that, if you're doing card test. But if you do a colonoscopy from a gastroenterologist, you're good for 10 years, if it's normal. If they find any polyps, you're good for 5 years. So up to the age of 75, you need to, when you turn 50, so again, the colonoscopy starting age is 50. If you're 50 and above, you need to get a card test every year, or I personally prefer colonoscopy because it's more accurate than a card test. Colonoscopy.
Well, I guess if the card test comes back bad, they would have you do the
Colonoscopy. But even without that, you can still go to colonoscopy right straight. And that's much better because card test is not accurate all the time. And if anybody in your family have colon cancer, your first degree relative mainly, then the starting age, instead of 50, it moves to 40. You need to start screening at 40 itself. So that's very important to know. Many people don't know that. Even if they have families, they wait till 50. But you need to be careful from 40 years itself. So colorectal cancer is very common. And people think, there's a general, many people think, oh, I'm a vegetarian, I will not get colon cancer. That's not true. People who eat meat tend to get colon cancer more, but there's no proof, it's all theoretical. But still, there are many vegetarians who get colorectal cancer too.
I would think, if anything, it might have more to do with processed foods.
Processed food, yes. Definitely processed food, fatty food, and all. Fatty food can be vegetarian or non-vegetarian too. So any of these foods will put you at risk for colorectal cancer. And early sign of colorectal cancer is rectal bleeding. And people think sometimes hemorrhoids, but if you have rectal bleeding, go to your doctor on that the same day.
Yeah,
Don't wait.
don't mess with that.
Don't mess with that. And lung cancer. So we hear about colon cancer screening, cervical cancer screening, and breast cancer screening. But there is screening for lung cancer too. If you have a history of 15 pack year smoking, pack year means you smoke 1 pack per day for the whole year. That's called 1 pack year.
1 pack a year?
1 pack year. 1 pack per day for the whole year.
Per day. Gotcha.
Like that. And many people who are smokers smoke more than that. If you are somebody who has a history of around 15 pack years, like for the last 15 years,
You've
if
been
you are
doing that
smoking.
15 years or more.
So you
Which,
need to
you
know.
most people who smoke started when they were a teenager.
Exactly. And they smoke, and even though they cut down, but still, and you have done it in the last 15 years, you need to get a CT scan of your chest every year. CT scan of the chest, it's...
Is that likely to be covered with insurance?
it should be covered with the insurance because it's all...
Depending on the insurance, I guess.
Yeah, it also depends on the insurance, but I know the Medi-Cal covers it, and commercials also should cover it. But and it's a non-contrast CT. At least you should get once every 1 to 2 years. Low dose, it's a low dose radiation. Chest X-ray will not pick up your chest. Chest X-ray cannot be used for screening of the lung cancer. It should be CT of the chest. And prostate, obviously. And people 55 to 69 years of age, check your prostate levels every year.
Now, I've heard for years that more people die with prostate cancer than
Before they
from-
know it,
from
right? And
right?
yeah.
That's pretty accurate.
Yeah, because the problem is prostate cancer will enlarge your prostate. Your normal prostate also tends to get bigger at the age of 50, and people think the symptoms caused by big prostate are from the prostate BPH, that it's a non-cancerous enlarged prostate, and they tend to leave it. But unfortunately, it can be prostate cancer, and it spreads to your bones very fast.
Yeah.
The prostate cancer spreads to bones.
That's not a fun one.
Right. So then you're right on that. Like many people think it's just a normal enlarged prostate, but it's prostate cancer. So there are so many cancers in your body, like liver cancer, ovarian cancer, and everything. But these are the cancers that can be prevented, that can be not prevented, that can be screened. Prevention is one part that we talked about, your lifestyle, obesity, and all those things with the HPV vaccine and all. Breast cancer, colon cancer, lung cancer, cervical cancer, and prostate cancer, these are cancers that we have the screening studies for. There are many other cancers like liver cancer, ovarian cancer. There are no screening studies. If you get it, unfortunately, you deal with it. But these 5 cancers are something that can be screened for. People should be aware of it and make good use of the medical facilities available and just try to get these tests done by your physician on a regular basis.
Are you aware of if people have any of those cancers, of the treatments, are there steps being progressive steps being made in the treatment of cancers that don't necessarily involve radiation or chemotherapy that tends to destroy people's bodies and lives in the process of treating the cancer?
It depends on the cancer too, right? Like breast cancer, for example, if you catch it early, you can just do surgery and you don't need radiation and chemo. Depends on whatever cancer. Cervical cancer, prostate cancer is another common example. You just take out the prostate if it's early stage. You don't need radiation. Yeah. So early detection.
But that's still the main treatment is radiation. And
There are
chemo.
three modes of treatment of cancer: chemotherapy, as I said, radiation, and surgery. Not everybody needs all three, but if it's advanced, people need all three. So depends. Sometimes you don't even need surgery; you just need chemo. But you know, chemotherapy and radiation. I mean, chemotherapy is the worst with all the side effects, unfortunately. Yeah.
Yeah. It's a trade-off because you can live longer, but
Right.
the quality of life will suffer.
And in many patients, quality of life will suffer only for short term. Sometimes there are many cancer survivors who are
That's
great,
true.
who are
There's more
great
cancer survivors
inspiration.
than we used to have, for sure.
Yeah, exactly. Because the advancement of the treatment that's available is amazing, and they get back to their regular lives. I have so many colleagues who survived cancer I'm very proud of them. They are inspiration to others.
That's good.
Yeah.
That's good news.
Yeah.
We used to have a Relay for Life event in Mountain House for a long time, and I'm not even sure that's still going on, maybe in Modesto or somewhere. But it seemed like there was an awful lot of money raised nationally or even internationally for cancer study. From your perspective, does that appear to be making a difference, that there's a lot of money put into finding solutions, that one day we might not have to deal with cancer, or is it just going to be a thing?
I wish there is one day that we do not have cancer.
I know that's a lot to ask.
But
That's a big question to ask.
I really wish. Cancer is very deadly, obviously. And but the way that we are progressing, the humankind, the kinds of processed food that we are eating, and the kind of stuff that we are, our lifestyles and stuff, I don't think cancer is going away anywhere. But we need
So
to
really
find new ways.
prevention is probably the best solution,
Yes,
huh?
prevention is the best solution. Early screening, and if you still have early treatment. Yeah.
How much of it plays into genetics?
It does, definitely. Genetics play a major part. Any cancer, the oncologist tests the patients for genetics.
Are there stem cell treatments or something that they're testing, that they're looking at? There's ways to stem off the genetic
Right.
level of...
I'm not aware of any hospitals in the area that implement the stem cell treatment. I think still it's in the research stage. I really wish the stem cell treatment comes through, because it can not only cancer, it can treat anything, so many. So
Right, it can kind of rebuild the body.
Exactly. It is unexplored science.
So it's down the road.
Down the road.
In the meantime, take care of yourself.
Right.
And do these things to prevent it in the first place.
Right. I hope the viewers take, if not all, the major stuff, summary. Many people should understand that obesity itself is a risk for cancer. There are many ways to tackle obesity. Think about them and contact your provider. Cancer prevention and screening is better than treatment. So work with your physician and get preventive measures and screening methods on a timely basis.
And that said, even the treatments have gotten more effective, I guess.
Yes, more effective, yes.
That's great.
Yeah.
So-
And if there are any people suffering with cancer, there are so many groups, supportive groups, and in the community and in there. Please don't feel that you're dealing with it alone, because it takes a lot on the patient and the family also, emotionally and financially too. But use your peer supports and use your physician. And there are so many measures available to support the patient and their family. Please use the help that's available.
You probably have some resources and people that you could direct people to. in
Yes,
those
I mean,
situations.
yeah, definitely. There are so many groups available. There are so many psychologists available. Having cancer is not a social stigma or anything. People will hide it and go into their own shell and deal with it and suffer through it emotionally, because you need to be mentally strong to go through the treatment. If you're not mentally strong there itself, and if it's difficult to deal with the adverse effects of the treatment.
And it's not an automatic death sentence in many cases.
Exactly, yeah. There are many
not every
people
case, but-
back to their regular jobs. Yeah, it's just temporary break from your regular lifestyle. Yeah.
In more and more cases, at least. yeah.
More cases, and it's getting better and better every year.
So we plan to do this every month.
Yes.
Do you
Yeah.
have something in mind for next month? I think you told me a couple of things you were looking at.
Right. I'm planning to focus on each month's occasion. Like I forgot what is March important for. We'll take a couple of topics for
you
next
looked
month.
it up while we were talking.
Right,
last time,
right.
think
I
we
don't
said,
remember on
but
top of my head. Yeah.
I don't either, but we'll figure
Yeah,
that out.
we'll figure that
We'll
out.
put that out for you. If you like this stuff, let us know. We plan to do the Health Matters show just as a public service, as on a monthly basis, as long as we can keep things going. And,
Yeah.
And help get the word out there so people can live happier and healthier lives.
And if viewers have any interesting topics that they would like to hear about, please
There you go.
let us know.
Yeah, you let us know. Like and subscribe, leave some comments. Happy to entertain your comments and questions. And Dr. Chituri's office is open 6 days a week
6
now,
days a week, yeah.
including Saturdays, not Sundays, right?
Yeah,
Most
not
Sunday.
Sundays for now. Yeah.
For primary and urgent care. So you can go in there, you can make an appointment or even just drop in.
We can walk in.
Yeah.
We can walk in still. Yeah.
Well, I appreciate you doing this.
Sure.
I think it's a good thing. We really want to have a steady, consistent kind
Right,
of
right.
programming
We'll
going
try to
on,
do as
so.
much as we can, and it's for the community. Yeah.
So again, I want to thank Khalid Saleh on the board here. He's kind of taking care of us. Do we have any questions or anything over there?
She's being approved now.
All right, well, maybe next time.
Yeah.
Or let us know what you think about all this, and we will continue to pursue this more and more. This is on MoHoTV, or Mountain House Matters, Mountain House Health Matters tonight. Thank you, Dr. Chituri,
Thank
for
you.
being here again. I
Thank you,
appreciate it.
Brian, and thank you for having us. Yeah. Thank you.
And I guess on that note, we will say goodnight.
Good night.